The thyroid gland is located at the base of the throat. It consists of two lobes that are connected by a thin isthmus. It produces two hormones: thyroid hormone, and there are two versions of this, and calcitonin. Let's look at thyroid hormone. Thyroid hormone is synthesized by thyroid follicles. I have circled a thyroid follicle in this histology slide. In the lumen of the follicle is a substance called colloid. Colloid consists of large proteins called thyroglobulin and iodine. Thyroglobulin is made from tyrosine amino acids. Synthesis of thyroid hormone requires iodine, which must be included in your diet. This is your body's major metabolic hormone, and there are two types of thyroid hormone: thyroxine, or T4, and triiodothyronine, or T3. The 4 and the 3 represent the number of iodines bound to each one of these hormones. Follicular cells release primarily thyroxine, but at the cells, thyroxine is usually converted into T3. Most body cells have receptors for thyroid hormone. Levels of T3 and T4 in the blood are maintained through negative feedback mechanisms. When the levels decrease in the blood, or when an individual is exposed to cold, receptors in the hypothalamus pick up these changes. In response to these stimuli, the hypothalamus secretes thyrotropin-releasing hormone, or TRH. TRH travels to the anterior pituitary and stimulates cells there to release TSH, thyroid-stimulating hormone. The target for TSH is the follicular cells. The thyroid gland, in response, produces more T3 and T4, secretes T3 and T4, and grows and develops. Increased levels of T3 and T4 in the blood initiate a negative feedback mechanism, decreasing the release of TRH from the hypothalamus and TSH from the anterior pituitary. In addition, increased levels of thyroid hormone will increase the metabolic rate. This, in turn, will increase body temperature, returning it back to normal. Most cells in your body have receptors for thyroid hormone. There are multiple actions that result from thyroid hormone. It increases the basal metabolic rate. This is the amount of energy required by the body to carry out all its reactions when at rest. For example, it will increase the number of ATP-requiring sodium-potassium pumps, the oxidation of glucose, and gluconeogenesis. During chemical reactions, some of the energy will be lost in the form of heat. So, thyroid hormone will increase body heat as well. This is the calorogenic effect. In response to thyroid hormone, cardiac cells increase or upregulate the number of adrenergic receptors they have for sympathetic neurotransmitters. This will result in an increase in heart rate and heart contraction. Thyroid hormone has a permissive effect on growth hormone. Thus, growth hormone requires thyroid hormone to exert its full effect. In addition, thyroid hormone is necessary for the normal development and function of the nervous system. This hormone is critical during fetal development and early infancy. It increases neurogenesis, the formation of the myelin sheath, and the differentiation of the glial cells. Let's look at some imbalances for thyroid hormone. Let's begin with hyposecretion in infants. This condition is called cretinism or congenital hypothyroidism. It develops when an infant is born with inadequate thyroid function. If not treated early, delayed physical and nervous system development will occur. It is completely avoidable with early diagnosis and treatment. Infants are screened for hypothyroidism at birth to prevent this permanent damage. In adults, hyposecretion is called mixed edema. The edema is due to an accumulation of a mucopolysaccharide in the dermis that binds with water. Hypothyroidism will lead to increased secretion of TSH from the anterior pituitary due to the negative feedback mechanism. The thyroid gland will grow in response. An enlarged thyroid gland is called a goiter. If you are familiar with the actions of thyroid hormone, you should be able to determine what the symptoms will be for hypothyroidism. I have a few of the symptoms listed here. I will want you to try to figure out why this patient is exhibiting these symptoms. Now let's look at hypersecretion, in particular, Graves' disease. In this disease, the body produces an antibody called thyroid-stimulating immunoglobulin, or TSI. TSI binds to the receptor on the follicular cells for TSH. In response to TSI, follicular cells will increase the production and secretion of thyroid hormone. This leads to hyperthyroidism. A condition called exophthalmia will also occur. This condition will protrude the eyeballs anteriorly. If left untreated, this will permanently damage the optic nerve, leading to blindness. This flowchart illustrates the normal feedback mechanism that controls thyroid hormone levels in your blood. The hypothalamus releases TRH, which binds to its receptors at the anterior pituitary. In response, the anterior pituitary releases thyroid-stimulating hormone, which binds to the follicular cell receptors in the thyroid gland. This stimulates the release of thyroid hormone into the blood. As the levels become elevated, a negative feedback mechanism occurs, going back to the anterior pituitary as well as the hypothalamus. This will decrease the release of TRH and TSH. In Graves' disease, the antibody TSI, or thyroid-stimulating immunoglobulin, is formed. It will bind to the receptor on the follicular cell, not allowing TSH to bind. However, it is not under negative feedback control. As long as it is bound to the receptor, thyroid hormone is being produced and secreted. The levels of thyroid hormone continue to be elevated. The negative feedback mechanism still occurs, so TRH levels are decreased. Therefore, TSH will not be released by the anterior pituitary. But since it is TSI that is causing the increase in the thyroid hormone, this has no impact on the levels of blood thyroid hormone. Hence, hypersecretion occurs. In this illustration, you can see some of the symptoms of Graves' disease. Again, use the information that you have about the actions of thyroid hormone and try to determine why these symptoms appear. Let's move on to calcitonin, the second hormone released by the thyroid gland. Calcitonin is produced by parafollicular cells. These are cells located between the follicles. This hormone decreases blood calcium levels by causing it to be deposited on bone. It is antagonistic to parathyroid hormone, but in human beings it's not significant in maintaining homeostasis. This histology slide demonstrates where the parafollicular cells are located.